This is Rachel Dworkin for the Chemung County Historical Society. I am reporting for the COVID Memory Project. Today is October 29th, 2021, and I am here speaking with
Crystal Gullo-Buzzeti.
Thank you. Crystal, you are a chiropractor, is that correct?
I am.
Do you have a chiropractic business?
I do. It's Healing Arts, Chiropractic, and Wellness in downtown Elmira.
All right. Can you tell me a little bit about how the pandemic has affected the operation of your business?
Well, we were not exactly not considered essential workers. We were allowed to practice if we had patients with life or death situations, which is not typically what we're treating per se. So I did close my practice on March 16th of 2020 in accordance with the FEMA declaration that this was an emergency non-essential closure. Yeah.
And have you reopened?
I did not reopen until August 2021. And that was due to my clientele. I treat mostly babies and very early in their life. So a lot of them have a lot of immune compromisation. And I wasn't confident that we could treat them in a safe way without having some adult exposures to the child of COVID and the Delta variant that popped up later in this year.
So what kind of precautions have you taken to ensure the welfare of the children you are treating and also of the staff?
So despite the changes with the CDC allowing more, closer contact and longer periods and no mask with vaccination, we have not implemented those things. We are still instituting a strict operation in the office. Our doors are closed. We're by appointment only. Our appointments are scattered with 30 minutes in between them so we can effectively sanitize, and we have HEPA medical grade air filters in each room so we can run that half an hour between clientele. We do a full health screening before they come into the building, so they have a questionnaire that's sent to them via text message. And we do a full temperature screen and COVID screen at the door as well. We also require full masking. We prefer N95, which is really hard, but we do order like KN95s from South Korea. And if patients are willing to wear those, we ask them to wear those in the office instead of the paper mask or the cloth masks. And we have an entrance specifically for entering, and then we have an exit specifically for exiting. And we don't have a waiting room anymore. We don't have people waiting together anymore. And all the staff is COVID tested weekly. And we buy our own, and we do a, at home, like Binax test. And we all wear N95s all the time in this building.
Okay. Are you vaccinated?
I am.
Did you request or require that your staff also be vaccinated?
I did not. All of my staff were affected heavily by COVID and had two have had losses. So I didn't really have to say anything to them. They actually just went out and did what they felt they needed to do for them and their families, and all of my staff are vaccinated.
And how many staff do you employ?
I have one employee, but I also have healthcare professionals that lease space in the office that also deal with, sometimes we cross-manage and co-manage patients.
Oh, okay.
They are all also vaccinated, yeah.
So I imagine closing down for over a year was a pretty big economic hit.
It was a huge hit for us. And we did it for the community because we knew that we did not want to be the source of an outbreak, which I think could have devastated our business permanently. We've been here for 11 years, so I was confident in communication with our patients that we'd be able to reopen and be okay afterward. It was going to be a slow rebuild, but eventually I do feel like we'll be okay.
So do you feel that you are effectively rebuilding currently? It's only been, 4 months? No.
Yeah. So we've had a regular, our schedule's still truncated. We're not at full capacity whatsoever. We're still operating at about 25 to 30% of what we were pre-COVID, which is difficult, but also necessary, I think, for the safety of my little patients. Yeah. So we had a huge economic impact. We were only open January, February, and part of March, and we lost about 85% of our income through COVID for that long. And we could have reopened earlier. We all had personal impacts as well at home that prevented us from really coming back here full force. Yeah.
Were you able to obtain like grant funding or PPP or anything like that to help offset those costs?
Sorry, I didn't mean to interrupt you. In 2020, we did not get any help. We were thankful that we were all able to get unemployment, which we got quite later in the year. Probably, I think most of the staff were able to get it around June of 2020. And we did get a small EIDL loan for the chiropractic business. And 2021, we were able to apply for PPP.
Okay. So were you on unemployment, or was it your staff who was on unemployment?
Being self-employed, we were finally able to get unemployment for all of us who are self-employed. And then my one staff member, I actually didn't have her until this year.
Oh, okay.
So she was always here kind of like helping, everybody just, stock a product, or she would come in and clean the office, but she never really worked here. During COVID, we realized, we really wanted her to work here. So she was the only person who was never an employee because she never really worked here. She came in to read books and and visit. So this year she's our employee now.
Okay.
So yeah, she was the only one that wouldn't get unemployment because she wasn't actually working here. Yeah.
So did you have any difficulties with applying for unemployment as a self-employed person?
I had never in my entire life had unemployment, so I wasn't even sure of the process. But early on, we all applied early on when they opened it up to self-employed individuals, and it was probably 30 to 40 days after the pandemic started before we ever even heard a voice on the other end of the phone. It was just calling. I would call maybe twice a week and sit on the phone and just put it on speakerphone and plug my phone into a power outlet and just let it sit on hold. And it would sometimes be 8 to 12 hours of it being on hold, and then we'd hang up to go to bed. So it was a while before we got through to unemployment. Yeah.
Once you were able to get unemployment, were you able to get the bonus unemployment?
Yeah, I think I can't speak for the other girls. I'll speak for myself. I can't recall when that went through. We did get unemployment, and then I know for myself, I didn't get the federal additional unemployment. It was a while. It was almost into the summer when they went back and said, okay, so here's when it went through, and we're going to send you that amount of money for that.
I know with folks who had been laid off, they had to fill out forms indicating that they were doing job searches. Was that something you also had to do, even though you owned a company?
Yeah, they had it was all on the website for New York State. It's funny because I believe there was a notice on the page when you would log in that said, because you had to go in and certify your benefits every week. And it would say, I think that it wasn't going to jeopardize your unemployment, but there was a place for you to go in and log if you would search for any other employment. And I do remember receiving a phone call as well from someone at New York State offering a job somewhere else, like to relocate and move somewhere else. Obviously outside of my expertise wheelhouse.
Okay. Um, is there anything else that you'd like to talk about in terms of how the pandemic affected your work and employment?
I don't think so.
Okay. So shifting gears a little bit, I understand that your husband works for the health department. Is that correct?
Yes.
And in what capacity?
He's the public health director.
How did his work affect you and your family during the course of this pandemic?
There was an enormous amount of stress on the family due to the emotional toll that COVID had on, I think, probably all the healthcare staff at the health department. I can't really speak for him and how he felt necessarily, but in my perception, the sheer amount of stress and concern for the community safety, concern for healthcare workers having the essentials that they needed to stay safe and healthy for their families, and to be able to help community members that got sick was an extremely overwhelming stressor, definitely on the family. And then time-wise, we really didn't see him very much for about 10 or 12 months. I'm sure most of his staff, not just him, but they kind of lived at the health department, trying to manage all the facets of how to keep the community safe. So it took a big toll. I do have a daughter, and there are a lot of people out there that strive with a one-parent home, and they do, they have the same kind of stress. So I don't want to compare it to that, but it was difficult managing the stress of COVID, the isolation of COVID, the school aspect that was uncertain, and also the impact his job had on us. Yeah.
Okay. I understand that there was a lot of pushback in the community against the public health department. Did any of that impact you and your family?
I think it was hard to hear some of the things that were said in the community and some of the conclusions about maybe the integrity of the health department. I think knowing the people that work there, and I think there are a lot of places in government that we can question whether or not people care about people. I can say I'm trying to say this from a non-biased place because he is my husband. Knowing the people that work there, I think there are very few people in government that you're going to find that really are there because they care about the community and they do want to make changes for the health parameters in the community in positive ways. And I think it was difficult hearing, even though it's normal, like people should question everything. But I feel like that was really difficult to process, about the feeling that there would be any, that there was a lack of integrity, or that there would be a withholding of information, or because that simply just wasn't true. Outside of that, stuff occurred, but I don't really want to mention that.
That's fair. You have a daughter. How old is she? What school is she in?
She's 8, and she, up until this year, was at Chemung Valley Montessori.
And that school had closed due to the pandemic. Were they doing online classes?
2020. Yep, they closed, I believe, in March or April 2020. And then they were back in session in September with masking and distancing and shielding, and they did really well, I think, in that school year. Yeah.
So what happened between April or March and September?
They were doing what most schools were doing. They were doing virtual, which was new for them, and they, I think, did the best they could with that ability of trying to reach the students at home, which was nice. I think everybody kind of realized the kids were just going to have a break for those couple of months. Yeah.
Okay. So shifting gears again, unless there's anything else that you want to talk about the pandemic and its impact on your family.
Yeah, I think that's it.
I understand that you came down with COVID.
I did.
Can you tell me a little bit about like when that happened, what it was like, what it's been since then?
I got COVID in April of 2020, about 3 to 4 weeks after I closed the office. I was isolated at home, and our assumption is that it was brought into the home. It was too early in the pandemic, and there were no supplies and no testing, and I was not considered a direct contact, so I was not given a test to verify it was COVID. But my symptoms were, they were the traditional COVID symptoms. I lost my sense of taste and smell. It started with a really horrific headache, like the worst headache I've ever had, that lasted for a couple of days. Lots of, at the time, most people were complaining of like muscle spasms in their back, like severe muscle spasms. I had all of those things. I was kind of in denial and hoping that I didn't have COVID. I couldn't see why I would have COVID. And it progressed daily. I did not have lung symptoms. I didn't have shortness of breath with any pain in my chest or my lungs. However, I did have low oxygen, which I did measure at home myself with an oximeter. And it was probably about 12 to 15 days in before I sought some medical help, which was not hospital medical. And I wasn't in such a severe crisis that at that point anyway, that I thought, I needed to go to a hospital.
So how has your recovery been since?
I've definitely had some long haul COVID issues. It did cause, initially, it caused issues with my blood sugar, being unmanageable, and issues with my kidneys and my blood pressure. So I did seek my primary care for treatment of those things. And then I did try another medical treatment, but it was IV infusions for vitamin C, vitamin D, B vitamins, magnesium, calcium. I had a lot of gut issues after COVID, and I was not able to absorb a lot of my nutrients on my own for a while. And that treatment helped me do that. I'm not saying that treatment saved me from, dying of COVID. I'm saying I wasn't processing my food well after that with my gut issues. So that was an alternative to get the nutrients I needed to try and get better.
And has that so that has cleared up the gut issues and the blood sugar issues, or
the blood sugar issues did resolve. I still have some difficulty, like I am not able to absorb vitamin D very well after having COVID. So I still get injections every couple of weeks for that, which is something people don't really know about, like getting an injection for that. And I still get, based on my blood work, I still get infusions, and my blood pressure is better, but it's still not normal.
So you're not the first person that I've talked to who has had long haul COVID issues. do you know if there are like treatments and plans in place for folks like you who are going to be needing this presumably for quite some time?
I've been trying to read more peer-reviewed research about that because I do think globally there is a urgency to recognize long-haul COVID and the impact that's going to have on health disparities and healthcare cost. In the circles that I run in healthcare and some of the nurses that I often communicate with, it's not really a topic right now. Of course, we're going through another surge currently, and I think it's on the back burner at the moment.
Okay. Is there anything else you would like to discuss about your illness and your recovery?
No, I think the public is quick to dismiss the urgency of long haul COVID because they just see that more people recover from COVID than die from COVID. However, the long-term consequences, even if you're asymptomatic, can be devastating, and it may not pop up for a while. And I think that that really is something people should be concerned about in the long term because it's going to affect everybody, either monetarily or in the job market when these people can't work. I also feel that I have access because of my profession and I have a PhD in nutrition, so I read the literature, and I've reached out to medical professionals that do this like infusion stuff that I feel like I have access to something that regular people may not have access to. In that knowledge and reaching out to people who can provide that service, and that service is not inexpensive. So knowing those things, I know that I'm in a different place with long haul COVID than other people might be. It might be way more devastating to them, not being able to work long term. We should all be concerned about that.
Okay. Is there anything else you'd like to add about your overall pandemic experience? If it's impacted you socially or in other organizations you might be part of or anything like that?
Oh, wow. It definitely has me. A lot happened during COVID. Especially socially. Being a Black woman in a chiropractic profession that is dominated by white males, it's the one social space I didn't consider that I wasn't quite, I'm very comfortable in my job, and I didn't realize that I didn't represent a very large portion of this community, the chiropractic community. And with all of the things that happened during COVID, including what happened with George Floyd, I realized, even in my career, there's a lot of work to be done with inclusion, diversity, equality, and equity. I always say COVID was a blessing and a curse. It was a blessing in that it gave us time to kind of stop and see ourselves and other people. And then, unfortunately, we had a lot of sick and ill people and losses, and we'll continue to have those losses for many years. So, in that way, it was a curse, but yeah.
If you're comfortable talking about it, you mentioned George Floyd and how that has caused you to reflect on your profession. There were a series of protests that happened in this city following George Floyd's murder. Were you at all involved in any of that?
I was not directly involved. We did communicate with, especially the two young high school ladies that organized the march. downtown. They were young girls. They were, I believe, 15 and 16 years old. And I remember communicating via Facebook, which I don't have any longer. Just being, I messaged one of their mothers and just to remind them how proud they should be. And I'm sorry that at this age they had to see this still. And organize an entire march just to remind people that we're human beings. And I know a lot of people don't see it that way, but I also think they sit in a position where they don't have to. With my 8-year-old and some of the threats that came in about that march from white nationalist movements around the country, I didn't feel comfortable going with her out of a safety issue. I know threats sometimes are just threats, but she's 8 years old and I didn't want her to, I'm her mom, she's my only kid. I wanted to protect her from any outside, threats that may have come to fruition with that, which they didn't, thank goodness. It was a very peaceful, very moving march. We did watch it from the YWCA, actually.
You're on the library board, correct?
Yeah, thank goodness, yeah.
So how did the pandemic affect your relationship with the library board, the proceedings of the library board?
I think the library did such a really great job. The board did a really good job. The meetings were, I feel like they were just as effective over Zoom as they were in person. Although I do enjoy the personalities of everyone in person. And I was just getting to know everyone because I had just joined the board. I mean, we literally had our 3rd meeting at the West Elmira Library because I remember one of the board members saying to me, "What do you think of this COVID thing? Are you nervous about it?" And I remember looking at her and I was like, I don't know. I don't know if I'm nervous. We'll see what happens. And then 2 days later, I closed my office down. I think the board did such a great job. I don't know. I feel like the library did so well with the closures. I love that they did the curbside pickup. Up until being on the board, I had been inactive as a patron at the library for a few years just because of work and I drive by it every day. My office is, I can see it right now when I look out the window. And I learned so much during COVID. I actually had time to stop and I was able to participate in a lot of the STLS system programming and the meetings. And if people only knew how much the library really cares, not just about the books, if they believe in the community and equality and safe spaces for everybody. It's so much more. The library is like a giant grandparent for the community. And I'm like, I didn't even want to be on the board. Like somebody asked me to do it and I'm like, what? Like, why would you want me on the library board? And then coming to the meetings, I'm like, yeah, this is really great. That took me back to like when I was a kid, when, we didn't have the internet and the library was my safe space. I loved the smell of the books and I was like, it's like I own all of these. I can take out any book I want. So no, the library did a fantastic job maintaining the board committee meetings and the trustee meeting every month and just making sure people had all that access to the digital library and the hard copies with the pickup. It was just really great. Yeah.
So you mentioned that the pandemic gave you more time to get involved in things that you had previously not been involved in, like with STS. Were there any other things that you found yourself becoming increasingly involved in as a result of having the time off due to the pandemic?
Yeah, I will say that the first 8 months of the pandemic were sheer panic, stress, and mourning and sadness between the losses, the hopelessness of if the government was going to do anything at all to help, and the social events that were happening. You know, people being murdered in the streets, and it was a big toll. And I think going to the social aspect, like with George Floyd, he was not the first, and obviously not the last. But we are so busy in this country doing a lot of meaningless tasks and also survival tasks that I don't think a lot of us had a chance to stop and feel to have to sit in the emotional turmoil. And I'm thankful that I had the opportunity. I am not thankful at the losses at all. I think it gave me more time to reflect after that 8 months on who I am, who I represent, even in my career, that, you know, I belong to this career, but I don't have to lockstep with anything, including my associations and, you know, our associations underneath the big ones. I don't represent them. I, first and foremost, am a Black woman and a mother, and then I'm a professional. I don't owe credence to people who don't see value in my existence. And I realized that a lot of, like, socially, fighting these fights and expressing the need to be represented as an equal human being in this country, that a lot of people, when my existence became an inconvenience, it wasn't valuable anymore. And that inconvenience could be making them uncomfortable with their own bias. So I definitely had to do a lot more reading on things that weren't work. I mean, I spend a lot of time reading research. That's what I do on the weekends. And I took a step back from, you know, doing the scholarly thing and did more of the, let's look at more social justice and how, you know, my 8-year-old is going to have to exist long after I'm gone. And she's a woman and, you know, a multiracial Black child, so she's going to have to, I don't want her to have to fight these same fights that my mother fought and now I'm fighting. Yeah.
Okay. Thank you. Is there anything else you would like to discuss?
I don't think so.
All right. Well, thank you again for speaking with me, and have a great day.
Thank you, Rachel. I appreciate you.